The world has reached another grim milestone in the history of the coronavirus pandemic. According to figures from Johns Hopkins University, COVID-19 deaths have passed the 3 million mark. The worst hit country is the United States, with more than 566,000 deaths. In Brazil, more than 368,000 people have lost their lives to the pandemic, and in Mexico, at least 211,000. They are followed by India and the United Kingdom. Now, if you look at the European region as a whole, it accounts for the highest total number of deaths at nearly 1.1 million. India is one of the hardest hit countries, and it's facing an alarming surge in infections. Day after day for more than a week, it's reported a new record daily rise in cases. The situation is particularly dire in the capital, Delhi, which has been placed on a weekend lockdown in a bid to contain the spread. But infection numbers are also exploding in other cities, like Mumbai.
Once again, Nantlal Beki and his family are packing their belongings. During the lockdown last year, the couple and their 2 children had to leave Mumbai. Now, a year later, they again say they have no choice. There are so many problems. I cannot work, so we cannot afford food. We live on just 1 or 2 euros a day. There's no other way. We have to go back to our home village. The taxi driver hardly has any customers. That's because Mumbai went into a 15-day lockdown on Wednesday after coronavirus numbers exploded. India has recorded more than 2,000 infections per day, and that has serious consequences for its hospitals.
We are definitely overburdened. We are already working at the full capacity, rather double of the capacity. Our initial ICU beds were less, but now we have increased just double the number of ICU beds.
There has been nationwide criticism that the weeks-long Kumbh Mela religious festival has not been cancelled. Millions of Hindu pilgrims have been taking part, many disregarding coronavirus restrictions. Of course we're afraid of the virus, but Kumbh Mela happens only once every 12 years and we've taken time off for it. Less than 10% of India's 1.4 billion people have been vaccinated. To date, 2 vaccines are being produced in India, and facilities exist to produce even more. But the pharma companies have so far refused to sign patent waivers, saying there's no evidence that would boost production. And a new struggle lies ahead, ever more aggressive mutations.
The virus is mutant variety. It spreads faster, and sometimes it is not even detected by RT-PCR. So that's why the number is high. Secondly, the human behavior.
It's proving too much for Nantlal Beki and millions of others who find work in the big cities. They are forced to look elsewhere during the lockdown. My money has been completely used up. I don't even have anything for the trip home. I hope to at least earn a few rupees in my parents' village. But last year, food was scarce there too. The family don't know how they will cope this time as they again drive into the unknown.
For more on this, I'm joined by DW correspondent Manira Chowdhury in Delhi. Manira, we just heard that horrible number, 3 million deaths around the world. India accounts for more than 175,000 of those deaths. Is that an accurate number for India?
Well, we are seeing a large number of deaths being reported every day. But there are also reports which suggest that the number of these deaths are probably being underreported, especially in certain states. And especially when we read reports which say that burial grounds and crematoriums are actually getting overwhelmed, they're running out of space. And that there is definitely a mismatch between the official death count that the state governments are publishing and the actual number of deaths.
Okay. Now, in the report we just saw, a family packing up and fleeing to the countryside with COVID-19 cases surging. What is the mood in large cities like Delhi?
Well, there is a lot of concern. There is a sense of panic which has started to set in. And not only because people can see that the second wave is spreading much, much faster than the first one did in the past year, but also because there's a large section of people which is very concerned about a proper entire lockdown being implemented once again, because last year we saw many people losing their livelihood, trying to walk back to their villages after losing work. So people are concerned for that as well. And as far as healthcare infrastructure is concerned, it is quite overwhelmed. Hospitals are running out of beds, out of ICU beds, out of ventilators, oxygen supply, medicine supply. So even the hospital staff is working under a lot of duress right now.
Now, could vaccine production really be expanded there if pharma companies waive their patent rights?
It's hard to say at the moment, but we have been seeing India, along with some other countries, trying to make this case that patent waiver may help in ramping up production. But as we know, wealthier nations are opposed to, and even certain pharma companies are opposed to this idea. But there are some experts who are saying that even though waiving the patent may not really be a magic bullet, but it will definitely help in improving access to vaccination.
Manira Chowdhury in Delhi, thank you.
We turn to Germany now, where the country is seeing its biggest spike in coronavirus cases since January. One of the main reasons is the slow pace of vaccinations. Fewer than 1 in 5 Germans has received a first dose. The rise in cases has prompted a warning from medical workers that intensive care units are being pushed to the brink. DW reporter Tessa Walter visited a Berlin hospital that is close to capacity.
We're at the intensive care unit in Berlin's Caritas Hospital. Half of the patients here suffer from COVID-19. Dr. Thomas König and his team have their hands full, and the beds are filling up.
Man sieht sehr langsam, dass es einen Anstieg gibt.
Slowly you can see that there is an increase. At the moment, we're not yet in a situation that brings us to the edge of what we can do. But we know that if the numbers continue to rise, we could certainly have problems.
Deutlich ansteigen, dass wir sicherlich Probleme bekommen werden können.
In recent weeks, the number of COVID patients in Germany's ICUs has been rising sharply again. By now, the peak of the second wave of the pandemic has almost been reached. Intensive care beds are becoming scarce, and the workload of staff continues to grow. Intensive care nurse Tim Küttler has also noticed that. Now in this third wave, it is particularly noticeable that the patients are getting more seriously ill and they are ill for longer. Also, they need a lot of care. That means the situation is very challenging and very stressful for us. You really need time to relax when you're off work. But it is not just the sheer increase in COVID patients that worries the team. Their patients' health is deteriorating faster in this third wave of the pandemic. They are also on average younger than before, probably also because most people over 80 years old have already been vaccinated.
Das Durchschnittsalter ist jetzt im Vergleich
The average age is now much younger compared to the first or second waves. We see that very clearly. We don't really have any patients who are over 80 years old anymore. They are almost non-existent.
Eigentlich so gut wie nicht mehr.
To what extent German hospital capacities are reached varies greatly from region to region. While some are already completely full, others are still coping. One thing would help: more vaccinations.
Ohne die Impfung geht es nicht.
We won't get out of this without vaccines. They are very important. But it is also important to stick to hygiene measures, keep a distance, and observe current COVID restrictions. Each and every one must take this pandemic seriously and can do their part to make us get out of this as quickly as possible. If the number of COVID patients continues to rise, other important treatments would have to be postponed. In some areas in Germany, that is already the case. The situation, many doctors agree, is serious.